Good afternoon, everyone. Well, thanks for joining us for the third webinar in our series on safety, culture and climate. So my name is Tristan Casey. I'll be your host for today. Now, our webinar series is really designed to increase that foundational knowledge of what safety, culture and climate is, and today's no exception. We're doing a bit of a deeper dive into our focus industries, so healthcare, community services and public administration. So it's a bit of a mouthful for me, and forgive me if I don't mention all of them as I go through the presentation today. So we're fortunate to hear from some industry speakers today. We've got a few on the line as well as a leading academic, and without going into that to too much detail, I'll introduce those people in a second. So today we'll go for about an hour, and then that recording session today will be posted up online in a few weeks. So stay tuned for that. You should be notified about that as well. Now, our series today is an initiative of Workplace Health and Safety, the Workplace Health and Safety Board. Okay, so our speakers today, we do have three. Fortunate for these guys to give us their time. We're very grateful. Professor De Cieri is our academic speaker today, our expert, and she's actually joining us for a second time, so I'm sure she'll be very experienced in webinars by the end of our series. So Helen is a professor at the Monash Business School at Monash University, and she has over 30 years experience in health and safety as well as management research. So Helen's involved with ISCO. It's an institute that focuses on safety and health research, and I really do recommend that you check those guys out. So if you do go onto Google and just type in ISCRR or do iscrr.com.au. They've got some great resources there around health and safety with a focus too on the healthcare industry. So thanks, Helen, for being available today again. We're also privileged to have two industry speakers, so we'll get to know a little bit about them further on in our session today, but just to let you know who they are, we have Mr. Garth Richards, Principal Advisor with Queensland Health, and Ms. Derek Colley, who's experienced in human resources as well as safety, and she currently works with The Bridge, a not-for-profit organisation who specialises in disability care and support. So thanks, Garth and Derek, for lending us your time today, and we can't wait to hear from you a bit later. So myself, I'm a Principal Advisor with Workplace Health and Safety, part of the Leadership and Culture team. Now, before we jump into the industry-specific details, I thought it would spend a couple of moments just talking about our core concepts, safety, culture, and climate. Now, in terms of explaining it, I did come up with a bit of an analogy, so apologies, there are probably going to be a few of these analogies today. But imagine that the safety culture is like an iceberg, essentially, and there might be some scientists who want to discover a bit more about what's going on with this iceberg. So they land on it and they start to do a bit of a survey or an observational study about what's going on the surface of that iceberg. In an organisation, we might think of that as some sort of behavioural observation program, or maybe a workplace inspection, just seeing what's happening in the environment. And the next thing they might do is think, well, we need to know a bit more about this safety culture iceberg. So we'll crack open some rocks, we'll dig some holes and go a bit deeper into what's ticking there. In an organisation, again, we might see that in the form of maybe a systems audit, thinking about, well, what sort of systems do we have in place and how effectively are they implemented? Now, I guess the best way that a scientist can get an understanding of what's going on with the iceberg is to dig really deep and think about, well, let's drill right down to the core of that iceberg and see what's happening at that really deep level. In a safety culture context, that means we're spending time talking to people, interviewing them, understanding what they think about safety, what are their beliefs and their assumptions. Now, if we put all this together, we can come up with a bit of a definition of safety culture. We could say that safety culture is about the way people think, interacts with those systems, and produces the behaviours that influence our safety performance, I suppose. Now, safety climate, on the other hand, is probably a bit of a snapshot. You could think of those scientists as taking a picture of the iceberg. It's really that culture at any one point in time, and hence gives us a bit of an overall picture, a bit of a health check of how safety is travelling in that organisation. All right, well, let's move into our industry-specific information now. So one of the challenges that healthcare and community services have is that there's less distance between the work that they do and their customers, their patients or their clients. If you compare it to something like mining, there's, I guess when a worker is doing a task in mining, if there is a mistake, it's likely to affect him or maybe his team, but probably not his customers. In our target industries today, if there is a mistake, then that has a really big potential to cause some damage, not only to the employees, but of course the patients or the customers as well. So probably because of the high stakes nature of our industries today, safety is everywhere. We can see it in the form of the technology, the drugs that people use in these settings, patients themselves. How do we preserve patient safety? But probably we don't take that time to step back and think at a macro or a very high level. You know, how is safety traveling in terms of that culture? In healthcare and community services, safety is inherently social. It's about the way that staff interact with each other and their patients. So we need to come up with a social solution, and that of course involves culture. Now in safety, there's these pivotal moments where we have an insight or a reflection and really start to change the way we think about how we manage safety in an organization. So Chernobyl is one of those key events where the International Atomic Agency reflected on that event and came up with a report around safety culture being critical to managing those really important, I guess, infrastructures. Healthcare is no different. We have a report there roughly 15 years ago from the United States Institute of Medicine, where they really focused on this notion of errors and mistakes and how it's actually a fundamental part of being human, that we do make those mistakes. That report really uncovered the importance of culture in managing how we talk about errors and how we make sure that those errors actually translate into tangible safety improvements. As you can imagine, the report uncovered, I guess, things about the safety culture in our target industries today that really needed some remedial work. So things like removing blame, making sure that discussions were open and promoted learning, and were built on a foundation of trust. These are the topics that we'll explore a bit further in our session today. Now, the report also, I guess, cemented this idea that learning and continuous improvement is a really important part of how we manage safety effectively. That's always been there from probably 20 or 30 years ago, where we can notice that connection between learning from our past mistakes or learning how to improve the current situation and transferring that learning into our safety management. We can also start to think about how that is underpinned by the culture of the organization, beliefs about the nature of time itself. So are we focused on reacting to the past, or are we managing the current situation? Maybe our surgical teams making sure that they're communicating and identifying risk correctly, or are we even anticipating the future? You know, what could go wrong, and thinking about different strategies we can put in place to prevent those mistakes from happening and having a safety impact. There's also those cultural elements of trust and blame, and maybe the tension between those two things. Is our culture one that promotes social harmony, or are we more individualistic and maybe concerned about preserving our own reputation rather than owning up to things that can go wrong? These really deep-seated beliefs, they're often invisible, hidden, but nevertheless they do bubble up and influence the way that people behave. So I'd like to ask you in the audience there a question at the moment. So you'll see that up on your screen in a second. The question is, how would you think a typical employee in your organization would react if they made some sort of mistake or error in the workplace? So would they walk away, hope people wouldn't find out about it? Would they blame someone else, try and fix it, or really talk about it openly and try and help people think about how to improve? We'll just collate those responses. If you are interested in this notion of a learning culture and how it impacts safety, I recommend you look up a couple of names. So James Reason is very popular in the safety management field, and he talks about how to establish a learning culture, as well as a researcher called David Hoffman. So he thought about what's called error management climate, this idea of how do we make sure that people learn from errors, and incorporated that into safety climate. So we've got our results up now. what we can see here is that, well, most people, 55% of people said that the employee in their organization would actually try and fix it before anyone notices that something was wrong. Maybe we can think about that as a quiet fix or a silent fix. There's really, a missed opportunity there to learn from that event and share it. Ideally, what we'd see is that employee feeling comfortable to talk about it openly in their next team meeting. So you should see a picture of an aircraft carrier there, and we're probably thinking, well, why is that up there? How is that relevant to our industries today? Well, an aircraft carrier is an example of what's called a high reliability organization, or HRO. So HROs are similar to healthcare because they have these really complicated yet dynamic operating environments where things do have a high potential to go wrong. And when they go wrong, there can be some pretty big catastrophes as well. So if you think about healthcare, there's complicated surgical procedures coming together, lots of different players in that room to all go towards the same goal. And if the mistake is made, it could not only impact the employees, but also the patients and other people in that environment. So because of these similarities, a lot of the concepts from what makes an HRO an effective organization is starting to be applied to healthcare and to some extent community services as well. The key point about this research is that the secret sauce or the ingredient around HROs is their workplace culture and how they encourage people to think about things that go wrong and apply that to improve safety. So let's turn now to some of the characteristics of our target industries today that I guess define them or make them unique and can carry through to how they manage safety. So some of the characteristics that we might say define healthcare and community services are that people are attracted to that industry because they generally care about people. There's an alignment of their personal values with what's trying to be achieved at the organization. They've got identities. They have this notion of who am I as a nurse or a doctor or a care provider, and that flows through into their purpose and their roles and in the way that they behave. Probably because of this, there's what we call this deference to expertise, that people with knowledge and skills are highly respected and look towards to answer difficult questions some of the time. The jobs in these industries also carry some stress at times, different ways of rostering things. The high demand on healthcare services, for example, does create an environment where we are sort of in that present moment and maybe not so concerned with what's happened in the past or what's going to happen in the future. Some other aspects might be a cultural belief around striving for perfection, that we are experts here, and because of these high stakes nature of what we do, if we do make a mistake, that's just not good enough. So by reflecting on some of these characteristics, you can start to think about, well, this macro culture or this professional culture, all these different beliefs that people bring into the healthcare or community services roles, how's that actually going to influence safety? We can also think, well, maybe we need to think about that lived experience of people in these industries and how we can leverage those beliefs to actually make our safety culture interventions more effective. And just a quick note to say that, as is the case with our other industries that we focus on with our webinar series, there's a lot of evidence to suggest that adopting this cultural perspective on safety management is an effective one. Just to summarize some of the studies out there, we can see that culture and climate flows through safety behaviors and actually influences outcomes like injuries for employees and also issues that affect our customers or our patients, so treatment errors, falls and infections. So what we'll do now is, enough from me probably, and turn to our first speaker, De Cieri. As I mentioned, she's very experienced in this field, and she'll be able to give us some insights into safety in a healthcare setting. So Helen, if some people haven't listened to the introductory session, would you mind just giving a little bit of an overview of your experience in our industries today and what you've been working on?
Well, thanks for that introduction, Tristan, and thanks everyone for listening today. My work is in leading research teams in a range of industries, but we do quite a lot of research in the healthcare sector. So in the last couple of years, we've worked with around 16 public hospitals, some aged care, residential community services organisations, and we've also worked with the Australian Nursing and Midwifery Federation members to design and implement research projects. Most of our focus is on finding out from workers what they think about health and safety in their workplace, how they perceive the safety climate in their workplace, and trying to identify ways to prevent illness and injury from occurring. So we'll use a range of methods. It might be that we collect baseline data in an organisation where we ask people for what their current experience is of health and safety. And then the organisation might introduce some change management programs to seek to improve health and safety. They might be focused on a particular area like musculoskeletal disorders, or it might be seeking to improve awareness of safety climate issues in a more broad sense. And then we'll evaluate those changes and seek to identify where improvements have been made, which is great. It gives you a chance to demonstrate the value of those change programs, but also to help the organisation to understand what changes can be made in the future. So hopefully, Tristan, that gives you a bit of an overview of the kind of work that we do.
Yeah, great, Helen. Thanks for the detail there. You can take it away now and tell us a bit more about what you've been doing there.
Great, thank you. So today I'm going to talk through some different research that we've conducted in healthcare settings, and I'll use a recent survey we did with the Australian Nursing and Midwifery Federation members as an example, because those nurses are working across a whole lot of different healthcare settings, so they give us a bit of a window into a range of healthcare environments. And I'll also try to bring in some of the knowledge that we've gained from other studies in public hospitals and aged care and community services. Really where I'd like to end up today is thinking about what we can do in terms of practical steps to improve health, safety and wellbeing in healthcare settings, and talk a bit about the integrated approaches that have been identified as really delivering some valuable changes in organisations. And I'll explain what I mean by integrated approaches as we go through. So first of all, to talk a bit about some of the research that we've done. In 2014, we conducted a survey with ANMF members and got responses from almost 5,000 of those members. It was an online questionnaire that was emailed out to ANMF members. And 2/3 of those responses were from registered nurses, but it also included enrolled nurses, midwives and personal carers. About 93% were female, and one of the interesting things about the nursing workforce is that 81% of them said that they had more than one job, so they're in more than one workplace. And I don't think they just meant working at home as well as in the healthcare setting. So it's quite different from the picture that you find in other industries such as manufacturing, for example. And as Tristan has indicated, it's a really complex working environment with a lot of issues going on. So when we asked people questions, we asked them a range of questions around health and safety and risks and hazards in their workplace. And this slide gives you an overview, a very simple picture of the kinds of hazards that people identified in their workplaces. And you can see that they cover issues from chemical agents and noise and needle stick injuries through to more psychosocial issues such as fatigue, stress, bullying and violence and aggression. And really, with the several different questions we asked in the survey, we saw that the psychosocial aspects were major concerns that were prevalent in this healthcare workforce. When we asked people whether they had had experienced bullying in their workplace, 42% said yes, which is higher than we see across other industries on average. When we asked people whether they'd experienced occupational violence or aggression in their workplace, 2/3 or 67% said yes. And in fact, a quarter of respondents, so around 24%, said that they had experienced occupational violence or aggression at least monthly in the past year. Now, when we asked them what the source of that violence and aggression was, the majority was from patients, but also people said from patients' relatives and from patients' visitors. And so we can see that there's a lot of issues that are related to the client group that the healthcare workforce engages with and the other people, members of the public, who are involved in the healthcare setting. Now, a lot of the times the violence issues are related to the kinds of clients that are that the healthcare workforce is engaged with. So when we looked at the kinds of work settings, we could see that people were working in aged care, in mental health units, in emergency departments, and indeed they were probably some of the areas where we saw more complex issues around safety climate emerging. So to understand the safety climate overall, we asked a set of questions about the positive steps that people saw being taken in their workplace. And we used this 8-item measure called the OPM-MU, which I've discussed in the previous webinar. We know it's a reliable and valid measure of the kinds of steps that are taken in workplaces. We ask people about whether health and safety is given the same priority as efficiency in a hospital, for example. Or we ask people whether they've got the, the equipment they need to do their job safely. And when we looked at the responses from the members of the ANMF, we could see that you get quite a different picture across different kinds of work settings. But as I've mentioned, areas like mental health and emergency departments were where we saw some of the lowest scores. That is, people were less likely to agree that there was a strong safety climate in place in those areas. When we compare this to research that we've done across public hospital departments, we see the results are similar. Generally in healthcare, on this kind of simple measure of the safety climate, in healthcare we see the scores ranging from around 25 to about 29. When I compare that to the work we've done in other industries, like construction and mining and manufacturing, the average is a little higher. It's around 29 on average. So we can see that healthcare faces some particular challenges in trying to deal with safety climate issues. Now, when we look at the different kinds of workers in healthcare, again, this ANMF survey gives us a little bit of a different picture around the different kinds of workers. If I focus particularly on personal carers, we see that they were the group that reported some of the lowest ratings of their workplace with regard to safety climate. Now, when we look at personal carers, they also said that they had the least amount of control over their work and over their safety. And as Tristan was mentioning earlier, public healthcare settings can be perhaps some more hierarchical settings, so where people feel that they are not listened to or where they don't have the opportunity to speak up about health and safety. They also tend to be those that have poorer experiences of health and safety. When we asked people about their experience of injury and illness and OHS incidents in general, we saw that personal carers tended to have more incidents than the other parts of the nursing and midwifery workforce. So it raises particular issues about how we could address and improve safety experiences for workers such as personal carers. And personal carers might work in settings like home care services where they're providing direct care with a lot of patient contact, and that could expose them to risks that perhaps other workers in healthcare are not experiencing as much. Now, numbers are one thing, but I also like to hear what people say about health and safety in their workplace. And so in our research, we often ask people for open comments, or we might have focus groups with employees asking them about their health and safety. And that's something that any workplace can do, or any work health and safety manager can do, is to ask your workers about how safe they feel or what they're worried about with their safety. In our research, we've seen some common themes about safety climate. One of the areas is around shifts and rosters. They're often an important theme, that night duty and rotating rosters are often linked to experiences of work health and safety incidents, of injuries. We also see that workload is an issue that often comes through as being linked to stress and fatigue, resulting in, again, injuries and illnesses. One of the other themes that comes through in healthcare setting in particular relates to incident reporting. And what we hear a lot is that people are very focused on patient safety and they'll report incidents related to patient safety, but they are less likely to report incidents related to their own workforce health and safety. And we know that incident reporting is really important. We know that it gives you the information you need to then make informed decisions about improvements in the workplace. So getting good incident reporting systems in place can be a key area of improving a safety climate. Also, the message people get from their managers about whether health and safety is a priority is one of the issues in healthcare. That is, that we support health and safety for workers as much as for patient safety. We also did see positive examples happening in workplaces. It's not all doom and gloom. We've seen some great examples of initiatives in workplaces in healthcare that are making a difference and improving safety climate. So health and safety representatives can play a really important role in finding out the issues and advocating for employees in health and safety. And where we see the managers listening to employees and health and safety reps and taking action, we see workplaces doing much better in terms of reducing their incidents and improving performance. So I've got a couple of examples there of where workplace representatives said, we've got these things happening and it's making a difference in our organisation. In our research, we also ask people about health and safety experiences beyond safety climate. And as Tristan has indicated, the research shows that safety climate is important because it has an impact on employees' motivation and on their behaviour. We know that where people rate their workplaces more highly on safety climate, they're also more likely to be motivated to do things safely and to engage in safety activities in the workplace. We've found this across a range of industries, as much in healthcare as it is in other industries. So one of the other things that we've been able to show through the research is that direct supervisors, might be a nurse unit manager, it might be the coordinator for home care workers, it might be the work health and safety manager, but supervisors and managers play a really important role. They transmit the organisational values to employees about health and safety. And when we ask people, how much does your supervisor support health and safety? Does your supervisor place an emphasis on health and safety? Is it discussed in meetings? Does your supervisor care about your health and safety? When people rate their supervisor more highly on health and safety, there are fewer health and safety incidents in the workplace. Supervisors do make a difference. So looking at the resources available for your supervisors, the sort of training available for nurse unit managers, for example, can be one of the ways you can contribute to a better outcome for health and safety. We also ask people about their own experience of issues such as burnout and emotional labour, which we know is important in healthcare. It's a really caring profession, dealing with difficult issues in patient care, and that can place a strain on the workforce. Now, where people are more likely to say they feel burnt out, that they have to cope with difficult emotional situations and still appear cheerful, that they've just got a work overload, that it's a very physically demanding environment, they end up having more health and safety incidents. And some of those issues can be endemic in the healthcare work, and it's hard to remove issues such as physical demands completely, but we can manage them more effectively. So lifting practices that prevent musculoskeletal issues are one of the key ways that we've seen improvements in health and safety, for example. But we also know that where people say it's okay to speak up about health and safety, it's okay to voice concerns without fearing backlash, without being seen as a troublemaker or believing that something will actually improve, they're also less likely to have health and safety incidents. So even where there are difficult situations that workers are dealing with, when they feel they can voice their concerns, that helps them to think through how to work more safely and to avoid and prevent incidents from happening. Now, to deal with these issues can be challenging. These are complex issues that go beyond the health and safety domain in many ways. For example, if we know that we've got people on rotating shifts, it might be that you need, probably is, that you need to work with other parts of the organisation to achieve improvements and to understand what can be done to manage issues like fatigue. So some recent work that's emerged from the US is looking at total worker health and safety. And it's trying to shift the mindset from just trying to identify risks and avoid them and just trying to encourage people to be safer, to really think about the strategic benefits for the organisation and for the workers. And that requires people in health and safety to work with areas such as human resource management and health promotion to get better impact. You can really exercise some more significant change when you're working with others across the organisation, so you don't have to do it alone. Some steps that we've identified in our research reports are, for example, linked to a range of factors. Now, you might look at this slide and think, where do I start? And you might look at it and think, well, we've already got some of those in place, but I'm not sure about others. Well, I'm suggesting you think about what will work in your organisation. So if you've got a blank piece of paper in front of you, that's okay. Start to jot down some ideas about what you want to achieve, what your priorities are, what the main problems are in your workforce and workplace, and think about where to start. So, for example, if you start with leadership commitment, you as a health and safety manager are probably well placed to understand the problems in your workplace. But if you can have a senior executive as a champion for health and safety, that can really help you to get the attention of your board and to get resources directed towards these issues. So working with senior executives to provide them the information that they need to make decisions can be very valuable. You might need a situation analysis, that is gathering the information to make a business case, understanding what the current main problems are. What baseline data do you already have about the kinds of injuries or claims that are happening? What policies do you already have in place? Gathering that information can help you to put together a case for resources to be allocated to improve health and safety. Figuring out who you need to engage as stakeholders. That might include the health and safety people, the representatives, human resource management people, key unit managers. Working out who will best help to champion and influence others in the workplace can be valuable. I always like having a plan, a bit of a plan, a policy helps, but it needs to be something you can actually use, not something that sits on a shelf. So having specific actions and accountabilities can help to bring your plan to life. And then thinking about what kinds of programs you can put in place can help you to identify how to prioritise within the next 6 months, the next year or the next 3 years, what sort of changes to bring about. And it probably needs to be reviewed and adjusted over time. So, for example, in one hospital department that we've researched with, they had run manual handling training programs, they'd run awareness around musculoskeletal disorders, kinds of initiatives for a while, but they'd found it really hard to reduce musculoskeletal issues. Then they sort of took a step back and realised that there are multiple factors that can influence musculoskeletal issues. So they looked at stress management and mindfulness training as a kind of different way of approaching the factors that can contribute to MSD, and that gave them a different way of approaching the problems and seeing improvements not only in MSD but in other areas of resilience for the workforce. Now, there are some more specific examples I'd like to suggest you consider if you're thinking about practical ways of improving the safety culture. So some key areas can be early intervention. So having health checks, having employee assistance programs available to people, looking at your risk controls can be ways of helping to provide a supportive environment for staff for health and safety. Looking at issues of work design can also be valuable. So, for example, in one hospital department, they looked at changing work practices, encouraging people to stand more because they'd been sitting for long periods of time, and that was linked in with back injuries. So looking at what sort of work practices and what sort of work design changes can be made can be valuable. And often you can get information about how to inform those changes from your incident reporting and understand what sort of things have been problems for you leading up to now. Work flexibility is something that healthcare people say, well, that's really hard, and it can be, but looking at ways in which you can deal with fatigue, deal with issues of rotating rosters and looking at understanding and informing people about how to manage their rosters can be helpful. And leading on to that, looking at awareness raising, making sure people have access to resources. Awareness raising with regard to alcohol and other drugs. In one group, they ran awareness around dealing with fatigue, looking at things like caffeine intake and how that affected people's sleep patterns. That can be really helpful for dealing with people on night shift and rotating shifts, for example. Also, looking at mental health first aid training is another area that organisations have found useful for managing stressful work experiences. Looking at recovery support, if someone has had an injury or an illness that's required them to take time away from work, looking at how we can support them to come back can be substantial. So we know from the research that where people come back to work and they're not fully recovered, they need additional supports and altered work patterns, for example, to ensure that they're not coming back too early. We can also look at ways of enhancing resilience, and I've mentioned mindfulness. That's one area that's been looked at in a number of emergency department workforces, for example, as a way of helping them to deal with the issues that come through the door. Also looking at areas like fit for work and life programs, looking at moving for life programs to improve employees' lumbar and lower leg flexibility, having workplace champions in place to assist staff and maintain their motivation through these kinds of programs can also be key ways of helping people to deal with the issues. And looking at the safety culture overall, I think commitment from senior leaders is really valuable. Being aware of safety culture and the ways in which you can build activities into an overall plan to improve safety culture is important. But I've also got there a culture of respect, and I think that's particularly important when we're thinking about psychosocial issues in the workplace and raising awareness around respect for colleagues, co-workers, clients, and the people who are associated with patients and clients can really help to contribute to a violence prevention culture in the workplace. Having the policy in place is great, it's an important part of it, but we also need to bring it to life through some of these key strategies and examples that I've been talking about. So overall, I'd say small wins can have a great impact, starting somewhere, whether it's through talking to your workers and finding out from them what sort of issues are valuable to them can be a good starting point. But we do need positive preventive steps in the workplace. We know that where people see the organisation valuing their health and safety, they're more likely to behave more safely and be motivated to engage in change programs for improvements of their health and safety. And then this integrated approach, the idea that you don't have to do it on your own, but bringing in other parts of your workforce to work with you. So it might involve people in human resources, people in health promotion, people in line management, certainly senior executives. Getting everyone engaged in trying to bring about change can really help the workforce to improve their experience of their workplace. So thank you for listening. That's my email if you've got questions for me, but I'm also interested to hear from the other speakers today. So thank you for the opportunity.
Thanks so much, Helen. I think that notion of an integrated approach to health and safety is really starting to gain momentum, not only in healthcare, but so many other industries. So I think it's watch this space. I know Workplace Health and Safety Queensland are looking at that integration, so getting different departments or units in our organisation working towards more integrated approaches. I'm sure we'll hear more about that. All right, well, what we might do now is turn to our industry representatives who've donated their time today. First one that we might talk to is Ms. Derricka Colley. So Derricka, she's a manager specialising in risk, safety and compliance in the disability sector. Derricka, if you're online there, could you just tell us a little bit more about your work, or a bit of an overview of your role? Hi, Derricka, you can go ahead now. Okay, sorry about that, folks. Seems we have a bit of a technical issue there. What we might do then is just turn back to Helen, if you're still on the line there, Helen. I guess one of the things that I'm curious about is maybe a little bit more about this integrated approach to sort of health and safety in a healthcare context. Have you come across any sort of initiatives in your line of work there where you're seeing that work quite well? Any examples of that?
So some of the work that we've seen has been, for example, with an emergency department group where they realised that fatigue was a major concern for them. And the health and safety manager worked with the health promotion and the human resources group in that it was a public hospital. And they first of all sat down with the employees and asked them about the major kinds of concerns for them. They did a survey focused on fatigue, really trying to understand what were the issues. And they identified that there were some rostering issues that could be improved. And so that was one way in which the health and safety manager couldn't deal with that on their own. They really needed to gain the assistance of the human resources group to look at rostering and ways in which they could address changes in the rostering to try to help people manage fatigue, and to just by looking at different kinds of rostering patterns, they could make improvements for health and safety benefits for the employees. They've also put in place a number of initiatives. So, for example, where the human resources group in the organisation generally conduct a survey of employees on an annual basis, they've worked with them to improve specific questions of interest to health and safety, so that the survey runs, everyone's familiar with the survey across the organisation, but it now includes more specific questions that address safety culture issues in that organisation. And so there's some of the simple ways in which organisations have had this more integrated approach that really couldn't have been achieved just by the health and safety manager alone.
Thanks, Helen. I appreciate you you're working with us there. We're just working furiously in the background here to check in with our industry participants. I'll just give them one more try. So, Derek, are you there? Are you online? Okay. Fortunately, we've still seem to be having those technical difficulties. So, apologies for that, everyone. I guess we might just continue the conversation with you, Helen, if you don't mind. So one of the questions that I did have lined up for our industry representatives, or really just a reflection, was this notion of the culture of care within healthcare specifically, and also community services. Is that, you know, people that are attracted to this industry obviously do really care about the patients and really want to invest a lot of effort to make sure that their welfare is maximised. But it does set up this interesting tension with safety, I think, whereby you know, that sort of notion of care doesn't really apply to themselves often, that they often put the patients above their own welfare, which obviously we can see some risks or injuries happen because of that. Is that something that maybe in your qualitative research you've come across, or, you know, just sort of a little bit more depth to that particular culture of care and how organisations are managing it?
Yes, and I hope we do end up hearing from Jerica, because I know I met her recently and I know she's really been using a very integrated approach in her organisation, and she's got some great achievements that she's made, which is terrific. But yes, with regard to this caring notion, we see it a lot, and it's also documented in industries such as the education sector. So people have, you know, said to us, look, why are you asking about my own safety? I'm here for the patients. Teachers say I'm here for the kids. And one of the ways in which we see this as needing to be addressed is that people sometimes don't report health and safety incidents because they're worried that it will get the patient in trouble. So it might be an aged care facility and they're worried about what will happen to the patient and whether the patient will be in trouble. They don't want to cause any trouble for the patient. But they might also not report incidents because they try to fix it themselves. Sometimes people might have great solutions because they're there in the front line and they know what can work, but if they report the incident, you know, that knowledge could then be shared with other people and the solution could be shared with other people. Or it might be that their solution could actually lead to other problems that they're not aware of. So reporting those incidents can be a really important part of helping to give organisations the information they need. One of the other just difficulties in the healthcare sector that we've seen, particularly, for example, from home care workers, is that when we ask them, you know, why don't you report an incident? They say, well, I didn't know how to report it, I didn't know who to report it to, I work night shift and the forms are locked in the manager's office and I couldn't have the form. I don't know how to work my smartphone enough to use what I'm supposed to do to report an incident. And so we could see there's a whole range of factors that prevent people or deter them from reporting incidents. And they're so focused on the patient safety and caring for the patient that they put this at a lower priority. In one organisation, they, for home care workers, developed a really creative way of dealing with reporting, where the coordinator had a simple checklist and workers could ring in and say, this was the problem, and the coordinator would note down the incident. So rather than the home care worker needing to write in a form, the coordinator could do that. And that was one way of removing the burden from the direct care worker and ensuring that they found it easier. And in that organisation, they found an increase in reporting, and that helped them to have better information overall. We also know that, again, with community care and home care workers, we found that workers who had attended health and safety training and where that training had covered issues like manual handling and reporting of incidents, those workers had fewer health and safety incidents, fewer injuries and illnesses. So this training and including issues like reporting, issues around health and safety for yourself, not just patients, in the training sessions really did feed through to improvements in health and safety performance. So there are a couple of examples for you.
No, thanks so much, Helen. They're very, very practical. I'm not sure. We'll just see if they've come online. So Garth or Derek, if you could just go ahead and speak now. Okay, it's a shame. Doesn't seem. Oh,
yeah.
Garth, is that you?
Yep.
Great. Thanks so much. Apologies, everyone, about that mix-up getting to this point, but it seems like we've at least got Garth on to talk to us today. Garth, we'll sort of allow you to introduce yourself there and just say a little bit about your role and the project you're working on at the moment. People will probably find that quite interesting.
Yep. Yep, I have. Yep. Yep.
Okay, Garth, could you just explain a little bit about your role there and the projects you're working on at the moment?
No, I don't. I have a.
Okay, so apologies guys, this doesn't seem to be working so well from a technical perspective. Really unfortunate because these two guys did have a lot to share, and I'm very sorry about that. I think at this point, rather than continue on, we'll try and look at an alternative session. Maybe we could get those industry folk to come together in a week or two, if they're open to it, and start to share their practical advice there. So stay tuned from us. We'll let you know what the next steps are, and we really want to make sure that their perspectives get heard there. Okay, in terms of Q&A, I think we've had a few come through. We'll gather those up and reply to those in time. There was a practical question though around the resources. So I did mention ISCA, apologies if I wasn't clear there. It's iscrr.com.au, that's Helen's research institute that she's associated with. That will be in the resource pack that we do post up on the Safety Leadership at Work website after this session, probably in a few weeks' time. You'll be able to download a lot of resources that actually link directly to Helen's report. Just having a look at some of the other questions here. Okay, so probably this one, I don't know, Helen, if you might be able to comment on this at all. So the question was, has the concern for personal safety in this context of personal carers or remote or isolated workers increased? So maybe just sort of an industry recognition that we need to do more in this space. Have you come across that at all?
Yes, it's interesting. I'm just checking. You can hear me, can't you?
Yes, all good.
Good. Yes, I think the awareness of the issues for home care workers and direct care workers is increasing, and we do see it also for workers who are isolated in remote and regional areas as well. There are some statistics coming through that show that they tend to have higher levels of health and safety incidents than workers who are in a, I want to say, a more contained environment or perhaps a more controllable environment, and where they have access to other people to discuss issues. So if you're managing direct care workers and home care workers, community care workers, for example, then some ways of bringing people together, so having regular training forums and forums where people can learn about health and safety issues, learn about what they can do to manage their own health and safety as well as patient health and safety can be really valuable. Also, keeping in touch with them, making sure they know who to contact can be very important. For some home care workers, they might not have a regular coordinator. They might just have a different person who assigns them their roster each week. But if you can identify more consistent relationships so that the home care worker can build a rapport, that they know the person who's coordinating their roster, that they've even got some, face-to-face contact with them, that can really help them to speak up and to know that there's a way in which they can learn from and share information. But also just awareness raising in the workplace through bulletins, through information can all be valuable, but need to be tailored to the kind of workforce you've got. So it might require, for example, communications in multiple languages where you've got a culturally and linguistically diverse workforce. Thinking through the sorts of channels that will best reach those workers are ways in which you can help to improve their health and safety. And yes, I think there is increasing awareness about these kinds of workers, but it's really been quite a neglected area of activity, in research terms at least. I think there's a lot we still don't know about their work experience.
Yeah, thanks again, Helen. I know in some of my previous roles as a consultant, we've worked with large aged care organisations, and they struggle. Well, I guess they're turning their attention now to these remote workers, people that may drive fleet vehicles to and from client premises. They're really acknowledging that there's a bit of a gap there in safety management. So using techniques like you mentioned of regular, catch-ups or bringing management down to talk to these guys more regularly and frequently about safety is starting to close that gap. I guess there's the issue there of that unpredictable environment that the remote worker could find themselves in, driving to a client's home and maybe having to use their personal equipment, for example, to do cleaning or whatnot. There's a lot of hazards there that need to be managed. So one of the techniques could be to invest more in that basic sort of health and safety competency, identifying hazards, managing them, putting in controls and checking whether they're effective.
Oh, yes, I couldn't agree more. One of the things that we've found is that people, just when you talk to people, they say, I never even thought about that as a health and safety issue.
That's right. Yeah, that awareness. Okay, well, we might call it a day. Apologies again about our industry representatives. We'll try and get their perspectives to you in some form. Yeah, really hoping to hear from those guys. In terms of next steps, so we do have another webinar scheduled for the 26th of May that focuses on the construction industry. We'll have Professor Helen Lingard join us for that, who's a well-known expert in this area. She specialises in construction safety research and has just done a big project on safety culture in that industry. Following that, we've got our final session, so our concluding session that will tie all the threads together and adopt a bit more of a practical focus in terms of where to from here and what actions can we take to start measuring and improving safety culture. Professor Andrew Neal will be leading that one. He's a renowned expert in this field, so we look forward to hearing from him. A number of resources are going to be coming out in a few weeks. So there's a couple there around safety climate surveys in particular. So selecting one that's effective and how to actually administer that survey and get some good quality data out of it are two of the main resources, as well as a summary from today, some of the research points that Helen mentioned, and some links to some really cool booklets or guides that you can download and start to inform the way that you're moving forward with your safety in your industry. So please do fill out the survey at the end today. Your feedback helps us make the sessions better. And again, apologies about our industry people. We'll get those perspectives to you. Thanks for attending and look forward to seeing you again.